Welcome back to Med School Radio. This is Simon, and I am reading the summaries which were presented from the first aid questions. It's a great way to review, so I recommend that you do it yourself. Thanks for joining me. Let's enjoy listening to these summaries. Hair cells on the proximal region of the organ of Corti, where the basilar membrane is thinnest, are responsible for high-pitched sound perception and are frequently lost in presbycusis. Multiple sclerosis is a clinical diagnosis characterized by at least 2 separate attacks with at least 2 different clinical lesions. Remember, separation in time and space. The most common symptoms of multiple sclerosis include motor and sensory deficits, asymmetric. Visual symptoms, visual loss or diplopia, and gait or balance disturbances. Organophosphate poisoning manifests as excess cholinergic activity, diarrhea, defecation, urination, meiosis, bronchospasm, bradycardia, excitation of skeletal muscle and CNS, lacrimation, sweating, and salivation. Atropine, which acts as a competitive inhibitor of acetylcholine at muscarinic receptors, is the treatment of choice. Pralidoxime is recommended as an adjunct therapy. The tricyclic antidepressants, or TCAs, including amitriptyline, are known to cause anticholinergic adverse effects, including dry mouth, blurry vision, confusion, constipation, tachycardia, urinary retention, and hot, dry skin. Neuroleptic malignant syndrome is a rare but sometimes fatal adverse effect of antipsychotics. Patients typically present with muscle rigidity, fever, autonomic instability, and delirium. Treatment includes dantrolene, supportive care, and discontinuation of the antipsychotic agent. Bupropion, a norepinephrine and dopamine reuptake inhibitor, is an atypical antidepressant. Bupropion is contraindicated in patients with anorexia nervosa due to an increased risk of developing seizures, as this patient population is likely to have electrolyte disturbances. Alzheimer's disease is a common cause of elderly dementia characterized by amyloid plaques, neurofibrillary tangles, and decreased acetylcholine activity in the brain. Donepezil increases the amount of available acetylcholine in synaptic clefts by inhibiting acetylcholine esterase and can provide symptomatic relief in patients with Alzheimer's disease. Primary sclerosing cholangitis, or PSC, is associated with ulcerative colitis. Up to 70% of patients with PSC have ulcerative colitis. PSC causes periportal fibrosis and alternating stenosis of hepatic bile ducts. Ethiocrinic acid is a loop diuretic without sulfur derivatives that can be used in place of furosemide to achieve diuresis in patients with CHF exacerbations who have a history of anaphylaxis in response to sulfur-based drugs. Hunter syndrome is an X-linked disorder caused by a deficiency of iduronate 2-sulfatase. The clinical presentation includes coarse facial features, aggressive behavior, pearly skin lesions, and clear corneas on fundoscopic examination. Excessive thyroid hormone secretion can affect the cardiovascular system through overstimulation of the sympathetic nervous system, leading to arrhythmias, tachycardia, hypertension, and increased cardiac contractility. Beta blockers are used to treat the cardiovascular effects of hyperthyroidism, resulting in a decreased heart rate. Absence of uridine diphosphate glucuronidase transferase results in Crigler-Najjar syndrome type 1, characterized by jaundice, kernicterus, and increased levels of unconjugated bilirubin. It manifests early in life and is usually fatal unless the patient receives a liver transplant. Fibrocystic breast changes are one of the most common causes of breast lumps in young women, presenting as multiple bilateral lesions that tend to fluctuate in size with menstruation. Chronic pancreatitis is commonly seen in individuals with a history of chronic heavy alcohol use, and it can present with steatorrhea. The steatorrhea is due to fat malabsorption caused by pancreatic insufficiency. This leads to a decrease in the lipolytic activity of the pancreas, causing decreased fat absorption, which can lead to a fat-soluble vitamin deficiency. Skeletal muscle and adipose tissue utilize GLUT4 insulin-dependent glucose transporters for glucose uptake, whereas the brain and erythrocytes take up glucose independent of insulin. Burkitt lymphoma develops following the T814 translocation and activation of CMYC, and presents with a starry sky appearance due to dark staining lymphoid tumor cells with interspersed light staining tingible body macrophages containing phagocytosed apoptotic cells. It is commonly associated with Epstein-Barr virus infection. Patients with increased estrogen, for example pregnant patients or those on hormone replacement therapy, have increased thyroxine-binding globulin levels. These increased TBG levels lead to an overall increase in total T4-T3 in the setting of normal TSH and normal free T3 or T4. Giant cell arteritis or GCA is a chronic vasculitis of medium to large arteries, most common in people greater than 50 years of age. The most commonly affected vessel is the superficial temporal artery. Biopsy of this artery is important for diagnosis. In the presence of fever, rash, and deteriorating renal function following antibiotic use, consider acute interstitial nephritis. Common culprits include penicillins, cephalosporins, and sulfonamides. One would expect to see white blood cell casts and eosinophils in the urine, as well as Fe sodium greater than 2%. Executive function, the ability to organize and perform tasks, can be tested by the clock drawing test, an element of MOCA. This is done by asking the patient to draw a clock oriented to the time requested. Anaplastic thyroid carcinoma is an undifferentiated and aggressive tumor that presents with a rapidly enlarging neck mass and regional or metastatic spread. Reed-Sternberg cells are pathognomonic for Hodgkin lymphoma. Hodgkin lymphoma may be associated with Epstein-Barr virus. Fever, weight loss, night sweats, pruritus, and cough are among the list of presenting symptoms. A family history of multiple family members with breast cancer diagnosed at an early age, less than 40, should raise suspicion of a genetic susceptibility to breast cancer, such as a BRCA1 or BRCA2 gene mutation. Patients with such histories should be monitored closely. Uterine prolapse is relatively common in multiparous women. It is due to the loss of support by the cardinal, uterosacral, or pubocervical ligaments that suspend the uterus in the pelvic cavity. Stretching of these ligaments will allow the uterus to prolapse, as they can no longer counteract intra-abdominal pressure. Complications of uterine prolapse include bilateral hydronephrosis and ultimately pyelonephrosis.